So I think we've introduced everybody. So now we're going to go to our presentation with Stacy Holt, Partners in Primary Care, soon to be CenterWell, which she'll give us all the facts on that. And then Joe Miller, manager of Walgreens. And they also have some exciting vaccination news to share, among other things. So Sharon is going to queue up a PowerPoint that they have put together. And then I'll turn it over to Stacy.
So I was muted. Now I'm not. So good morning,
that happens all the time.
Yeah, and usually I'm the one that's like, I can't hear you, you're muted. So I'm Stacy Holt. I'm the Center Administrator for Partners in Primary Care, soon to be CenterWell in Grandview at our Walgreens location. We are changing our name to CenterWell April 5th. So it's going to be same care, same name, same people. We're just expanding our reach and going into having the same brand name across the United States. So kind of exciting for us, but just we're right now starting to get that name out. So this was great timing. So thank you all for joining and letting us share that news. Can we go to the next slide? So a little bit about Partners in Primary Care, soon to be CenterWell. We believe you deserve to feel as welcome and comfortable as possible when you're sick, injured, or simply maintaining your health. We believe you deserve high quality care and consultation no matter what brings you in. And we believe you deserve respect for your time, your schedule, and your vision for your own health. So what we are is we're senior focused. And what we do is we take additional time with our patients. Instead of just kind of getting them in and out and maybe spending 5 minutes with the physician or nurse practitioner, your appointment will be like 30 minutes to an hour with the provider based on the type of appointment that you have. So once a year, you're going to have an hour with the provider, and every visit after that will be like 30 minutes. And we focus a lot on wellness. Definitely want to take a proactive approach to your health and partner with you on keeping you well, saving you money on your healthcare costs and your medications, and help keeping you compliant. So, we are, like I said, we are senior focused. So our goal is to help you reach whatever goal you have as a senior, whether that be save money so you can go play bingo, or get down on the floor with your grandkids to play, you know, walk a 5K, or be able to go out and go dancing 3 nights a week. So everyone has these different goals, and we're here to help you get to that. One of the things I've really enjoyed about working here is I feel like whenever you become a senior, you get to live your best life again. I feel like that a lot of the people I've seen, they're like teenagers with additional knowledge. They're smarter. And they just, sometimes I think they need to rest a little bit more, but they have that energy and that excitement, and it's really fun to watch. Their body just hurts a little bit more. So I think we have it backwards. We should have the pain and like the aches when we're younger. And as we get older, we should be able to live our best life and have all the knowledge so we can enjoy everything. So let's go to the next slide. In Grandview, we have a physician, Dr. Shana Ripley. She's board certified in internal medicine. She's been practicing in Kansas City. She has her bachelor's degree. She went to school for psychology. She's a great provider. She was before she came to us, she was at Truman Medical Center, and she was teaching students She also has a master's in public health. So we do a lot with screening patients for food insecurity. We've partnered with Harvesters. If they screen positive for food insecurity, we'll help them fill out like a SNAP application. And we have Harvesters food boxes here. So we're able to give them Harvesters food boxes. She's local. She lives right outside of Grandview, right over kind of by Longview. Mom of 2 beautiful little girls, and is really vested in the community and helping the seniors stay active and keeping them healthy. So she's here 4 days a week, Tuesday through Friday. And then on the next slide, we have Carol Harrington. She's local to the area, and she lives in Raymore. She's a nurse practitioner. She's here on Mondays. We're going to be adding her more often to our schedule. She has a strong background in cardiology and in internal medicine. She's been in the Casey area practicing for probably 20 years. She's great. She really takes time with patients, and with her strong cardiology background, she's also a diabetic educator. So she really will take time to answer those, questions, talk about diet, anything that you can do to stay healthy. She just did this really cool certification with one of our other physicians on food and how it impacts your mood. And so I'm going to have her end up teaching a class in our community room at some point. So I'll let everyone know. So Sharon, you can kind of put that out, because I want it to go virtual, and it'll probably be like on our Facebook. So both of those providers are here to be able to see patients. One of the things that's great about Partners in Primary Care, soon to be CenterWell, is we are physician-based. So the model is around a physician, not around a nurse practitioner or a physician's assistant. So you will get to see a physician. A lot of people prefer to see a nurse practitioner, but our goal is to have you see the physician at least every other visit. So that way we can make sure you're still getting, the physician and also the nurse practitioner visit. So, and we'll go to the next slide. I believe that has the rest of the care team. So the Grandview care team, Partners in Primary Care, we also have a pharmacist, Michael Smart. He's a Walgreens pharmacist, but he is embedded into our care model. He is inside Partners in Primary Care. He touches every single patient that we have, goes through, answers any medication questions, helps patients find alternatives to medication. If they're having cost issues, or if it hurts their tummy, or just anything. He's found a lot of patients that have been taking supplements that are counteracting their medication. So he's a great resource. We have a lot of patients who just bring in totes full of medication, and he'll sit down and go through it with them. So it's great. The patients love him. And then we have Caitlin Hitt, who's our RN. She's who we refer to as a care coach. If our patients are in the hospital, or if they have a chronic condition, she's going to partner with them. And right now we have her virtual. So we have an iPad, and she's able to do face-to-face visits virtually or over the phone, to touch base with them, see how they're doing. If they go in the hospital, she'll be talking to our patients daily. Leslie is our medical assistant. So she's here every day. She'll help room patients. Shanna Crow's our behavioral health specialist. We find that, whenever people start to get into the senior age, it comes with a lot of different challenges. Sometimes it has to do with their children. They go from being very independent to their kids trying to parent them. Or, sometimes we'll see the kids maybe want to take their car keys away, or their kids are actually trying to get them to raise their grandkids. So there's just so many different challenges that they face as seniors. They may have lost a spouse, they may have lost their best friend, or they may just be dealing with the fact that they're getting older and they still feel like they're 25. And they just kind of need some support. So Shanna is here to help, answer those questions and deal with that. So she's a great resource that all of our patients can utilize. They can chat with her for 7 visits, and then if the patients need additional help, then we'll refer to, a therapist or psychologist. Then down in the bottom right is Darren Story. He's our community engagement representative. So he will be out engaging with patients and telling them about our care model, and just like trying to get them to come in and take a tour of the center, telling them about Dr. Ripley. And then I'm in the middle, I'm the center administrator. I oversee all the operations and growth. And then on the bottom right is Taryn Husky. She is our patient support specialist, or I believe she does our front desk. So that's our care team here in Grandview, and everybody's here to take a hands-on direct approach and take care of patients. So then Darren, what his role does is he is out active in the community and helps spread the good news. He engages community partners and helps develop ways to collaborate. Physicians, CenterWell is a resource for the community, whether people are patients or not. So we have a community room, and prior to COVID, it was pretty active. We would do bingo. We would, have speaker events, have people come in and talk about finances, how to balance your checkbook. We've had hands-only CPR demos and certifications. So we have a lot of great opportunities. We did have silver sneakers in here. So our community room will hold probably 10 to 12 people. It's a really nice community room, and it's inside Walgreens, so you can get into it from Walgreens or from partners. You do not have to be a patient to participate. As soon as we get the okay, we'll be opening back up and have a robust calendar again. So Darren will help facilitate that room. He'll be in charge of hosting and helping sponsor community events, and he's mainly responsible for bringing in new patients and telling our story. We do welcome visits, tours of our facility, the community room activities, facilitating open house events, and he also partners with insurance agents and brokers to help educate on our care model. And then he's got, our job is simply to be the connector between CenterWell Senior Primary Care and the Grandview community by providing resources, a place to gather, and helping the community stay well. So we just have a big focus on wellness. And then the services that we offer are board certified physicians, and we are accepting new patients, care coaches. We do blood draws on site. We also have our patients, if they see a cardiologist, a nephrologist, infectious disease provider, anything like that, they can bring the orders into our center and we'll draw for them. So that saves them, because a lot of times what the biggest feedback we hear is they don't have to walk a lot whenever they come in here. That's stuff that we take for granted. And it's also easy to navigate. So, it's like 10 steps from their car into our front door, and they can sit down. Then it's maybe 7 steps back to the lab, where a lot of other offices, you have to go in and you have to, go to the information board, read it, navigate that. And if you need lab, then you have to go to the lab. So it's all about convenience for us, and definitely creating that great warm environment for the patients. So we're really here just to make it easy for them and create a non-stressful environment. We have the longer no rush appointments. We have timely follow-up. We offer same days appointments, and we also have 8 locations in the Kansas City metro area. We are Medicare Advantage friendly, so we accept Aetna, Coventry, Cigna, Humana, and United Healthcare Medicare Advantage plans. And then now I'll turn it over to Joe. He's our store manager here in Grandview with Walgreens, and he's been a great partner. We are so fortunate to be in Grandview with Joe.
Well, good morning, everyone. Thanks for being here with us today. Just in case you guys wonder if I stutter a little bit, I appear to be nervous just a little bit. I am, so just bear with me through this whole thing. So a little bit about me. So I began my Walgreens career in 2001 in Wichita, Kansas, and had relocated to the Grandview area in September of 2019 to really help with this partnership and to help bring Grandview something a little bit different to the community. So they really welcomed me in with open arms. You know, when we go through our jobs for 17 years, it's one of those things where it's something new and exciting for, I think, for both companies, both for, you know, partners and for Walgreens. And so it's really neat to be here and to really be a part of the community with something, with a different offering than what you get from a traditional Walgreens store. But it's really neat to see that we're able to offer all these things under one roof, because, you know, you go into the Walgreens traditional store and you get the retail setting, then you get the pharmacy setting, but when you can really come into this and really see what Partners has to offer, what they're really focused to patient quality and not patient quantity, it's something that's truly unique, and it can really help really transform healthcare as we see it in the future when you look at all the offerings under one roof for our senior citizens. Next slide. So I've been really blessed not only to be partnered with Stacy, but also with my pharmacy manager, Jennifer Philipschek. So Jennifer graduated from UMKC in 2000 with her doctorate of pharmacy, but she started in 1997 with Walgreens as an intern. And then in 2006, when we opened the Walgreens here in Main and Highway 71, she was here at that time. So she's been here since 2006 and is truly a mainstay and really a staple piece of Walgreens, and has really been here to really be the face of Walgreens for the last 15 years. So if you guys have been in, I know she'd be a face that you guys would all recognize. And then also Jennifer continues to work closely with UMKC. So if you come in and you see younger looking folks in pharmacy jackets, that could be an intern that she's mentoring. She continues to really support the pharmacist community, but also her alma mater as well, and helping develop that talent. So as COVID hit a year ago, you know, things change, and, you know, we have to figure out, you know, how are we going to change with, you know, with the changing times. Retail is a very fast-paced, changing environment, and that's kind of like the Missouri weather. You know, you just wait 5 minutes and it's going to change a little bit. But really, we had to really think fast with COVID and how are we going to respond to stay relevant during this time where social distancing, and how are we going to stay both convenient for our consumers and pharmacy patients, but also, you know, how are we going to keep driving our business? So we went through and listened to the public and made quick changes. And with that, we revamped our Walgreens app and renamed it to My Walgreens, and really went through and connected with, really trying to connect our platform from physical to digital. As things continue to evolve, we've really invested a lot to try and make this happen in a quick time frame for our customers. So in October, we launched My Walgreens Balanced Reward Program, which was a little bit of, it was really kind of hard to really explain to our customers. So we have now Walgreens Cash, which is where you get 1% back on name brand items and 5% on Walgreens brand items. That's just the simplified version of it. But our app continues to show that, but it's been really user friendly to go through our curbside pickup. We also have express pickup, and then our prescription savings club, which I'll talk about on the next 3 slides. And then we'll get into our COVID updates as well on the 4th and final slide. So with our curbside pickup, you know, with us limiting people inside, and also with the with the additions of like the DoorDash and the Postmates, and how do we continue to have people come to our site? And we do have plenty of DoorDashers and Postmate folks coming in and shopping for convenience of our customers. But it's easy as 1, 2, 3. You go on to our Walgreens app, you order online. We notify you when we pull the order in as little as 30 minutes, and you pull up to our curbside, let us know you're here, and we'll bring it out to you. The next is for prescription pickup. We looked at it, and sometimes during our drive time when it's really busy, it's you really don't want to have large lines and all that, especially through this whole COVID piece. So we went through and made it as simple as 1, 2, 3 as well. So you go online to our Walgreens app or Walgreens.com. You can manage your prescriptions. You pick the prescriptions you want refilled. You can pay for it there online, and then you have the option of either coming through our drive-through, or we can go through the express delivery, which can be delivered to your house in as little as 1 to 2 days via FedEx. So we really tried to outreach to our customers to make sure that they stay adherent to their medicines through this time of need, and to make sure that they can also stay safe, during this whole pandemic and then for time to come. Because once this thing passes, I have a feeling that we have completely changed the landscape. The way that not only do we do retail, but just the way that our consumer shopping and prescription pickup has changed. With that being said, in order to help with some of the adherence was the rising cost of prescription prices. And so we've revamped our Prescription Savings Club, which is, in easy terms, it would be our equivalent to GoodRx. So we have the Savings Club that will offer savings to generic medications and then thousands of name brand drugs, amongst other things, as far as savings on flu shots and pet medications as well. There's an online tool through the Walgreens app and also through Walgreens.com. So really, as we go through these last 3 pieces, is we're really trying to connect those folks that would come in to our digital platform so that they can have all the answers and questions at their fingertips. And then finally, with COVID. So we have COVID updates on our app, on our mobile app, and also on our Walgreens.com. And right now, as of this morning with our testing, so we now have, with our digital lab testing or our PCR testing, we have 32 locations in the greater Kansas City area that are offering the PCR testing. And that will take 1 to 2 days for results to come back. And we also have rapid diagnostic testing in 10 of our locations across the greater Kansas City area, where you get results within a couple hours. And really just, it goes through our drive-through. So you go through our Walgreens app, find a location that does one of these tests, set up an appointment, and then you come through our drive-through, and then our staff will walk you through the testing process and then notify you upon the results. Here in Grandview, we offer the PCR, so we do the send out, and usually we've had them back by 3 o'clock next day. We do say 1 to 2 days just because, as testing continues to take effect, we don't want to overpromise and underdeliver, so we want to continue to underpromise and overdeliver. So, but with the COVID vaccination, so as was said earlier about just supply and demand, right now I was hoping to have more information for you for the greater Grandview area and immunizations availability. But right now we're playing that same supply and demand game right now, as far as I really don't have a date of when we'll be immunizing here at the Walgreens to the general public as of yet. But as we continue to, as everybody continues to get the demand in, we're going to be updating our online presence with the updates, and you can go in and select a time whenever we do get the vaccination. Our team, so a little bit about how we've prepared for this and being able to take on this when we do, to take on this this big undertaking when we start serving the general public with the COVID vaccination, is that with many of the pharmacy boards, with the Missouri Board of Pharmacy here locally, we've our technicians have gone through the same immunization training as our pharmacist. And so back in the fall, when we were doing flu shots and stuff like that, we had two folks that were here on a regular basis, our pharmacists that were able to give immunizations. Now through this training over the course of the last 3 months, we've added 6 more immunizers to our technicians and interns to be able to help to really serve the community with the COVID vaccine once we get to go and get the supply in to be able to meet the customer demand here in Grandview, but also across all of our stores. We've worked really hard to make sure that we can provide, you know, the best care and still take care of our core business as well. Once we're able to really have that outreach to the community with immunizations. So unfortunately right now we're just waiting on them to land, but we are prepared for when it does land and hopefully get that out to the community as soon as possible when it does. One thing that just to kind of share a story is that I know that, and I'll be quick, but you know, we go through all this stuff. You know, I've been with Walgreens for 19 years and we go through all this change and sometimes we really wonder about, you know, does what we do really make a difference in people's lives and you know, just all these changes and you know, we go through just our normal work day and, you know, are we really reaching people? I had the luxury of going out into the community this last couple of months because we were serving long-term care facilities and immunizing them. And that was part of the Walgreens agreement was that, you know, in preparation for in phase 1, when we were going out to long-term care facilities and helping them immunize and took a couple of technicians and some pharmacists with us. And, you know, the first couple go through on our first immunization clinic. And, you know, I'm kind of amped up because I'm like, hey, you know what, I don't know how it's going to go. It's our first clinic. And, you know, the anxiety's a little high because, you know, everybody's wondering like, what's it going to look like, you know, when you get shot 1 and then shot 2, because, you know, it's still brand new to us. And one of my technicians, it was like the 3rd person that came through and she was able to call him by name, recognized him from the trips that they had in and really set him at ease. But then a couple of patients later, she was able to talk to, you know, another gal that was coming through and knew her by name and they knew each other. And so really, it really resonated with me that what we do here on an everyday basis, whether it's, you know, our seniors coming in for, you know, their appointment here, Partners in Primary Care, shopping our retail space or using our prescription, and the connections that we make on a daily basis, really, you know, people in the community recognize us, and it can go for any of us in any of our businesses, and that what we do on a daily basis, whether we believe it or not, we really make a difference and an impact in people's lives. And it really just kind of hit home with me, you know, during this, that we truly make a difference, all of us collectively, you know, within Grandview and in our greater community. So as we get bogged down in our day-to-day, just remember what we do on a daily basis, that we're truly making an impact on someone else's life. And it may not see it right then, but one day we will see it.
Thank you, Joe. Thank you to both you and Stacy. That was great. You know, Walgreens has been a long time fixture in Grandview, but it's great to get the updates. And Partners in Primary Care, soon to be Centerwell, they just jumped in a few years ago when that partnership came about and have been very involved, and we look forward to continued involvement. Right now, I think we're maybe planning some kind of grand reopening, rebranding, possibly the end of April. I don't know that we've got an exact date yet, but we will get that out to everyone. And Joe, if you can get us the vaccination updates,
yep,
we can, you know, put that out to our membership because there are a lot of folks still trying to get vaccinated. So